Hey everyone, I am super excited to do this IG Live with Dr. Kelly Blodgett. He is joining me. Blodgett was a podcast guest, one of my first podcast guests, probably a year ago. Learned so much from him, and I really did a lot of research before I did that interview, and I was shocked to find out how much fluoride is in our water, and the types of things that we're doing to our teeth that are still in practice today. So, amalgams, for example, the mercury dental fillings. Also shocked about, fluoride treatments, the amount of fluoride in water. So anyway, there's a lot to unpack. So I really encourage you to go back and listen to that podcast between myself and Dr. Blodgett. And anyway, make sure you ask us some questions. I'm sure you will have many. He is a wealth of information. And again, it's one of those things where I think a lot of us don't really think that much about our dental health, our oral biome, and all good health really starts in the mouth. And that's one of the things that I think is so fascinating. So if you have a lot of inflammation in the mouth, it can go south and it can cause inflammation in other body parts. So again, super important to just really make sure that you're taking great care of your teeth. And yes, so I floss, I do all the things. But I also, one of my big takeaways with Dr. Blodgett is, don't annihilate the biome in your mouth. And what he meant by that is you see these mouthwashes and toothpaste that say, we'll kill all bacteria. Well, maybe that's not so smart to kill all the bacteria, because some of that bacteria is doing really good things for your mouth. So, and if it's doing good things for your mouth, it's doing good things for your health. So I would definitely say I have made some changes since our conversation, my conversation with Dr. Blodgett, and probably 20 years ago, maybe even 25 years ago, I already had all my mercury amalgams taken out. And for those of you that don't know what that is, it's basically like kind of the old fashioned, I'll say that with quotation marks, the old fashioned way to fill cavities. And it's made out of mercury. I mean, that's like the main ingredient. And I always wondered, it goes to the dental office, mercury, in like a hazmat toxic waste bag. But then when it goes into your mouth, does it like become not toxic anymore? I don't know, but it's a good question for Dr. Blodgett, and I believe he is right here. How's
Hey,
it
Deb.
going?
Good, good. Thank you for including me today.
Yes, yes. Well, you are a wealth of information. I was just singing your praises to everybody who's listening so far, and you're in Portland, Oregon. I'm
Yes.
not quite sure how I found you, but are you speaking at my nutrition conference this year, NAMP? Or was that
Oh,
last year?
I did last year, and I
Last
think the
year.
year prior to that. Yep, yep,
Then I think that's where I found you. And
yeah.
I'm really glad I
Oh,
did.
thank you.
Your podcast with me was one of my most downloaded of
Oh, that's
2023.
awesome.
I think people really care about their mouths, other than just having, you know, ridiculously white teeth.
Well, yeah, and unfortunately, there's like so much misinformation and limited limited options being provided, right?
Yeah.
I mean, I think the communication in terms of, when people go in to see their dentist, it's kind of a one size fits all, right? It's like if you, and not only that, but you get one option. You aren't really actually given a full set of options from which you can make an educated
Right.
choice. So
Right.
yeah, the language
Yeah.
is kind of like around you need
Hmm.
this, and of course like the patient's thinking, well, okay, if you tell me I need it, I guess that's, I don't know. Who am I to ask you, right? You're the expert. But of
Right.
course,
Well, I think there's also a certain level of vulnerability. You're in a
yeah,
chair and your mouth is wide open. And, so communication is challenging. And I don't know about you, but when I'm in that chair, my mouth is open, I'm not breathing as well. So I get a little fuzzy headed. And
yeah.
sometimes when I'm like that, I'm not making my best decisions.
Well, right. And I mean, that whole dynamic from a psycho-emotional standpoint is so weird, right? Like, I mean,
Yeah.
we're as a provider, if I'm looking at something in somebody's mouth, I'm certainly not going to have a conversation around what I'm seeing and what I'm thinking while they're laying back and in a vulnerable position.
Right.
It's so inappropriate. Um,
Right. Yeah.
so yeah, there's a lot easier ways to do this,
There's
I
a
tell you.
lot easier ways to do this. And I was just telling our audience as we were getting rolling, I was doing your introduction. And I remember a conversation we had about mercury amalgams.
Yeah.
And I was telling our audience that I had mine taken out probably 25 years
Mm.
ago. I was an early adopter to like, oh my gosh, mercury goes to the dental office in a toxic waste bag or a hazmat bag. It goes into your mouth and like by some sort of miracle, it's no longer toxic. So I realized this is nuts. So I had them removed 25 years ago.
Yeah.
And I said to you on our podcast, I'm so glad that they don't use those anymore. But you corrected me and said,
Yeah.
oh my gosh, these are still in practice today.
Yeah. Yeah. It's funny. I was just talking with my brother this weekend who practices dentistry in Texas. And, he was sharing with me some of the conversations he's had with, dentist peers down there that there are dentists still clinging to the belief that there is nothing better than a, silver filling, because it's so, it wears well and you can chew on it for years that's not to say that that's untrue. It is pretty hard material, but
Right.
at the cost of what to your health.
Well, tell us a little bit about, what are some potential downsides to those old fashioned, I'm going to say, mercury, silver, like you said,
Yeah.
amalgams.
Yeah. Well, and for the sake of clarification, I use my fun, uh,
Yeah.
finger
Yeah.
quotations because in actuality, the majority of substance in a quote unquote silver filling is actually mercury, liquid
Mm-hmm.
mercury,
Mm.
elemental mercury. So, it's kind of it's almost like you're making a cake, right? You've got your liquid and your powder, and the powder happens to be silver, copper, and tin, which you're mixing with liquid mercury. And it forms this, what they call an amalgam, material and shove it into a tooth. And, I can still think back 30 years into, when I was in dental school and everything seemed like we were in like a woodworking class. We got to
Mm.
do dovetail cutting and I'm like, why do we do, well, you got to lock it in because it doesn't stick to the tooth,
Wow.
geez, well over 30, if not 40 years now, we've had bondable materials that you can adhesively glue to teeth. So if you can do that, why on earth would you be cutting much bigger
Right.
holes and putting in toxic
Right.
materials? And what, has been proven over time, a couple things. One is that mercury amalgam fillings are in fact always off-gassing and you're
Mm.
breathing it in and you're swallowing
Mm.
that elemental mercury. And to your point, right, it comes in a box that has a skull and
Right.
crossbones, you know,
Right.
and in order for you to have, to maintain your license in most dentist states, you have to have what's called a mercury separation system on the effluxing, outgoing water, that you're sucking out of people's mouths because it's so toxic. It
My
literally
gosh.
sequesters the mercury because we don't want it going into our water supply. So the idea that somehow it's safe
Mm-hmm.
when it's sitting in your tooth, it's toxic before and it's toxic after, but miraculously it's safe while it's in your tooth apparently. So,
Yeah.
and I think that the desire of most people not only is to have something that's more aesthetically pleasing, but from a whole health perspective, I suspect most people believe they probably giving their dentist the
Of
benefit of the doubt and thinking they're
course.
probably doing what's best for my health,
Right.
but they don't, oftentimes they're not even given the option. Like I've met people that I've known for years. They come into my office and I'm like, hey, how old's this silver filling? Oh, I just had that put in 3 years ago. And I'm like, how's that possible? You know, but it's still roughly, about a half the dentists in America are still using mercury amalgam fillings, which just, you know, in my opinion, like there's so many better options and safer options. Why would they keep doing that? But
why would they keep doing it? And it sounds like, you know, it's just once something gets into the, you know, like the medical system, it stays forever. And, you know, the other thing with mercury, it's a heavy metal. It's a neurotoxin. I mean, it really can cause so many issues.
yeah,
And it's not easy to get out of your body once
right,
it's in your body,
right.
because it really lodges in your tissues. So if there's a workable alternative, yeah, why wouldn't we use it? So I'm glad there's more um, data and there's more communication and there's lots of studies out there talking about this. So this is good. So it's not just our opinion.
Right. I mean,
Right.
anybody can go to PubMed. You know, you can type in mercury amalgam fillings and comma IQ. You know, I mean, it's, you could mercury amalgam fillings, and, you know, neurological damage. You know, people can go in there and just read the research for themselves.
Oh, that's
Yeah.
fascinating. Wow.
The same thing is true of fluoride, by the way. I mean, you know, in our generation, it's been like, oh, we're going to fluoridate everything, right? It's the greatest panacea. We're going to stop tooth decay. And of course, like this has been going on for 60, 70 years in some communities. And, you know, it's effectively had no healthful impact in my observation, whether people are fluoridating or not. Yet we understand through very good science that it does in fact impede your IQ and your brain function.
Really?
Oh, yeah.
So fluoride ingested from municipal water supplies can actually impact your IQ.
But not only ingestion, but think about like one of the most absorptive tissues in your body, it's your oral mucosa, right? So somebody
didn't know that.
Think about somebody who starts having an angina attack, you know, and they throw a little nitroglycerin under the tongue, right?
True.
It's like, absolutely, because it just soaks it right up.
Wow.
So same thing's true of like when you put that fluoride varnish on your teeth, like, oh, we're just treating the teeth. Well, you know, the moist mucosal tissues of the mouth are just soaking that stuff up.
Oh my gosh. You know, I had this is probably 10 years ago, and I was in the dental chair and they said, you really need a fluoride treatment. And I was like, well, what does that do? And well, we're just going to, we'll do it. And you'll, you know, whatever results you're going to get. And I remember as it was applied on, I was like, oh my gosh, what a bad decision this was. Cause it was like burning. I mean, my jaw, my gums were inflamed. And I thought, what have I done to myself? And then that's when I think I really started researching, you know, fluoride and water supply. And that's one of those things where I thought, how is it that we could drink, you know, fluoridated water and it's going to hit our teeth for a nanosecond? How is that going to protect our teeth in any way?
Right. Yeah. I mean, I get asked a lot, like, what do you think is the best toothpaste, mouthwash? And I'm like, okay, let's do the math of how long are you exposed to those products? I don't care what product, you know, like in reality, right? The one thing to which your mouth, like your teeth and your gums are exposed 24/7 is your saliva. So, you know, if we're maintaining good hydration, have, you know, effective and excellent, you know, gut absorption, and we're eating well and nutritiously, like, well, then the saliva is pretty much going to take care of the things that it needs to from a ongoing health balance and like a oral microbiome standpoint. So healthy saliva for the win.
Yeah, and you mentioned that on our podcast, and I had never really thought about healthy saliva. So, what about people who maybe have chronic dry mouth?
Right. So first of all, I'd figure out, why do you have chronic dry mouth? You know, is that I mean, gosh, almost all prescription medications as a side effect are going to have that side effect of, you know, shutting down your salivary flow.
Okay.
So I would be curious, like, well, for what reason are you taking medication?
Mm-hmm.
Are you doing symptomatic management, or are you getting to the root cause of health issues?
Mm-hmm.
So, and that's going to depend on whether you're dealing with what are you taking pills for?
Right. Right. And do you need them? Is there a healthier alternative? But is saliva also impacted by our hydration levels?
Absolutely. Yeah. I mean, if you're dehydrated,
Mm-hmm.
and I'm sure there are those who could probably use drinking more water, and also including electrolytes
Mm-hmm.
in their drinking of water. But yeah, I mean, I make a lot of referrals in my practice to functional nutritionists to help people get optimally hydrated, make sure the gut's functioning well, because without those core pillars to
Mm-hmm.
health, I mean, I can't do what I do well, right?
Yeah, that's really true. That's really true. Okay. Yeah, that healthy saliva, that is a fascinating topic. And are there things that we can put in our mouth to create a healthier saliva? Like, is there a gum or a mouthwash or anything like that that can help with that oral biome?
Well, that's going to depend, person to person, right?
Mm-hmm.
Like how disrupted is their oral microbiome to begin with?
Right.
Generally speaking, if someone, let's say they're blessed and, mom and dad had great oral and not just oral, but GI health, and they get passed along to them great, oral microbiome, and they eat
Mm-hmm.
well, they're probably going to be in balance most of their life. I mean, that's just what I see.
Mm-hmm.
Um, but there's a lot of habits that people develop, whether it's eating a lot of processed foods or drinking, I mean, you name it. It doesn't have to be
Yeah.
sodas anymore, right? It could be that sugary Starbucks drink that you're buying two of every day, and or it could be the chronic sipping on kombucha. Not
Oh,
saying I don't like kombucha, but there's a reason it's tart and sweet, right? Sugars and acids. So
okay.
it just
Yeah. Huh.
pays to think about what are the things that I'm sipping
Mm-hmm.
on or exposing my mouth, to throughout my day.
Okay. That's really good advice. Yeah. So I would imagine things like coffee. I mean, maybe that is okay and limited, but maybe you don't want to be drinking coffee all day long. I'm not sure if that's really a good thing. I don't do
Yeah,
it.
probably
Right
for a
now
lot of
I'm
reasons.
sipping ginger. I grate ginger
Yeah,
into hot
yeah.
water.
Uh-huh.
And that's kind of keeps me warm in the winter, and it's also
Nice.
such a great
Yeah,
anti-inflammatory. But for my coffee drinking friends
yeah.
out there, what do you say to that with the gut or the oral biome?
Well, I'm a coffee fan, right? As you mentioned, I'm in
Yep,
Portland, Oregon. I mean, we're the
exactly.
land of like micro brewed coffee and beer and
That's true.
you name it.
Yeah.
I mean, we love coffee around here, and to the point of constant
Hmm.
exposure, right? When I have a nitro cold brew in the morning, I'm not sipping on it for 3 hours,
Hmm.
So where I see people get into trouble from typically a decay risk
Hmm.
standpoint, it's that they have perhaps adopted a practice. Like here was a common one I saw 10 years ago.
Okay.
People were the fad of like lemon water and apple cider vinegar in your water, and
Yes.
it was this big fad. Like
Right.
everybody's doing it, kind of like the celery juice thing that came, either before or after it, depending on where people were in their
Hmm.
health journey. But they would do this and not like, knock it back so that the mouth isn't exposed to the acids for hours
Hmm.
upon hours, but they would sip on it and sip
Yeah.
on it and sip on it. And it's like, what? It's weird. I mean, some of these people I had watched for 15 years, and all of a sudden their teeth are eroding. And I'm like, that seems weird, you know? And
Oh.
so we really have to slow down and have conversations about, tell me about your lifestyle and your nutritional habits.
So good. Yeah, because I mean, I wouldn't have. I mean, I've never been able to subscribe to the apple cider vinegar. I used to have GERD, and so that just ripped my digestion apart. But as I did try it a couple of times, and I thought, oh my gosh, like you just if you do that, you need to really rinse with water after. But really, the same thing too with some chewable vitamins I've found in my practice.
Mm,
For people who are chewing a lot of like the vitamin C gummies or just the vitamin C
yeah.
tablets, you really need to do a rinse after because it's
Uh,
got some hang time on your teeth. Yeah.
yeah, it's unbelievable. It's funny because like, the same, I've just seen this pattern where, maybe some parents are well intentioned and they're trying to get their kids fluoride treatments and like we want to strengthen the teeth, but yet in their car all day long, they've got these like twist top, sweet, squeezy tube of fruit
Mm,
paste that the kids are like
wow.
sucking on all day long and it's melting the teeth. And it's like, okay,
Wow.
it's kind of interesting, like I think back when I was in high school, just again from a lifestyle standpoint,
Hmm.
if you wanted a soda, which, back in those days, I loved a
Oh
soda,
yeah.
you'd get a can or a bottle. And once you opened it, you had to drink it because you couldn't take it to class and
Right.
there were no twist tops,
Right.
mid 80s,
Yep.
right? So it's like these days you can take around your, fizzy, bubbly, sweet,
All
acidic
day long.
stuff and just, have a few sips, put the lid
Yep.
on. Have a few
Yeah.
sips, put the lid on. And the stuff's
Interesting.
toxic.
Interesting. Yeah, it is toxic. You're right. And I see people sucking on that stuff all day long. And the Starbucks, I call them coffee milkshakes, where it's got 25 packets of sugar
Yeah.
in it. And
Yeah. No, seriously.
yeah,
Like literally, it's
I know
pump,
it
pump,
really
pump.
does. I know.
Yeah.
And yeah, it's just, I was traveling over the weekend and I went to a Starbucks and brought my own container. And I said, my husband wanted a vanilla latte. I said, how many pumps do you put in? She's like, oh, at least four. And I thought, okay, I've
Wow.
measured this before. Each pump is a teaspoon and a half of sugar. So that already, like that, I said, can you do it with one pump? And we just won't tell him.
Yeah. Yeah. It's
Yeah.
still going to taste sweet.
It's still going to be plenty sweet. Well, let's move on to one of my favorite topics, probably because I've never had one, is root canals. And that was the title of our conversation today is, you know, are root canals something people should be concerned with? And if they've had one, is there anything potential they can do now to just kind of increase their health?
Yeah. So, and this is when we started our talk today and I was sharing about misinformation.
Hmm.
Um, this is where I truly believe that our human population today is widely unable to give informed consent because they're not being given their full options, right? The
Hmm.
typical pattern that you see happen is somebody has a tooth that hurts. Could be any reason. It might have
Right.
decay, might have a fractured cusp. They might have had their mercury fillings just replaced with some composite and they did a crappy job and now the
Hmm.
tooth's sensitive, right? And instead of looking for like for what reason is the tooth sensitive, it's just, you need a root canal.
Hmm. Hmm.
That's it. That's it. They don't say anything else.
Right.
Well, you need a root canal.
Yeah.
And like, so think about socially how we relate to that concept. Like, there's jokes. Oh, it's as bad as a root canal. But we've just normalized that term of, oh, I hope they don't tell me I need a root canal.
Hmm.
And we just accept that for some reason, if we kill this formerly living organ that's
Hmm.
attached to our living jawbone and leave it in place there, that somehow that's going to spell health.
Yeah.
And I
Right.
mean, almost every day that I am providing clinical care for patients, I'm removing root canal treated teeth that are oftentimes the root cause, pardon the pun, but
Hmm.
it's like that's the source of both microbial exposure and energetic disruption in that human being's body. And the second we remove it and reestablish health and energetic flow, it's just shocking what people will share with us
Hmm.
about their health turnaround.
And I remember you sharing some stories, but can you tell us one?
Absolutely. As a matter of fact, I'm giving a talk tomorrow in Central Oregon about, ceramic implants. But, in preparation for that, I want to acknowledge like root canals aren't the answer.
Mm-hmm.
And at the very least, if somebody's going to choose it, they deserve to know that long-term health impact,
Mm-hmm.
that it's going to be loaded with microbes. So anyway, here's one story. So maybe 2 months ago, had a lovely gal fly out from Nashville, Tennessee to see me. She had trauma to her front tooth and had a root canal on that when she was 19 years old. Subsequent to that, she started experiencing skin rashes, particularly after she experienced more, I would call it more generalized health strain by having I think it was 2 or 3 children. I can't remember how many kids she had, but it was right after she had her first child that she really broke out, right? And she was not able to get that turned around. And it wasn't until she watched the documentary Root Cause and came to understand, like, it's possible, right? It's possible that maybe this dead tooth has something to do with it. So she came out. She was a great spirit. I mean, she was like, I want to take selfies with my tooth out. I mean, we had a lot of fun with it. And
she's my kind of gal.
Yeah, so we took it out. We were able to clean out the area, put a ceramic implant back into the space, and make a custom, fitted ceramic tooth. It looked beautiful. And the coolest part, I mean, of course, it's cool from my perspective that it looks great, but from the health perspective, the last of her skin symptoms have now abated.
Oh my gosh!
As a result, and I mean, another gal I'll be talking about tomorrow, similar situation where she had a root canal tooth removed because it was so infected, and a titanium implant along with some little metal tack screws put into that space. And it turns out she's allergic to nickel, right?
No.
And every titanium dental implant has nickel in it.
Wow.
So, her symptoms were chronic migraines, along this.
Of course, it's right there.
Right?
Oh my gosh.
So we got all the metal out of her mouth, and like the next day it was gone. She hasn't had it come back since.
It's almost like okay, here's a pun. It's right under your nose. Like the whole problem was right there. You can use that in your speech tomorrow if you want.
Thank you.
Give me 10%.
Yeah.
But that's amazing. Like, I think we just don't put 2 and 2 together, or maybe it takes a couple of weeks for the symptoms to start, and then you remove it, and it's almost like an instant, like an overnight relief for these people.
Yeah, absolutely. And I mean, it's not to say like, well, if you've had a root canal or if you've had a titanium implant, is your health going to hell in a handbasket? I don't think so. I wouldn't say that for everybody, but at the very least, you want to be aware that it's a risk factor and to work with somebody who appreciates that. If you're working with someone who says, no, that's a bunch of baloney, like run
Totally.
away from that type of constipated thinking.
Right. Because it's constipated, it's old fashioned. And there's so many people talking about oral health now that we have to pay attention. Even the most skeptical person really needs to pay attention. I mean, if you think about, I have friends who've had hip replacements, and when they go in for dental work, they have to take an antibiotic. Is that common? I mean, that's common, right? It can be because that infection can go places. So if you just break it down into that simply of, okay, if you have an infection here, it's going to travel, then, again, I think the most skeptical person could, probably relate to that.
Yeah. And you're talking about somebody who's going in for a dental cleaning.
That's true.
We're not talking about like, are we going to open up a tooth, like literally kill it and let that porous structure of tooth, the dentin absorb microbes? I mean, it's an open highway of microbes going inside your body. It's just silly.
It is just so toxic. Yeah. Oh my gosh. Okay. I want to ask you a question.
Please.
So you talked about the energetic disruption. Can you tell us what you mean by that?
Yeah, absolutely. So, I mean, I would imagine most human beings, regardless of how you look at health, Western, Eastern, naturopathic, whatever, I would argue that we're all familiar with the concept of acupuncture, and many people have gone in for acupuncture. Well, if we believe that energy flows through the body, wouldn't it be silly to think that the teeth are somehow not included in that? You know? And in fact, they are included in that, and different organ systems and joints and things of that nature are connected energetically to the different teeth of our mouths. So one of the most common scenarios I see is, let's take, well, and this could be men or women, by the way, front tooth trauma. So common, right? I mean, people trip, they have sports accidents. Absolutely. The number of people that I have met that have had, like, let's say men with prostate issues or bladder issues, women with menstrual issues, bladder issues, issues with, either creating a child or maintaining a pregnancy, where they have root canals on front teeth, upper or lower, is shocking.
Wow.
Yeah. And we've had patients, by the way, who come in and they're like, we've been trying for 4 years, and, it finally dawned on me, maybe it's this front tooth. We take the tooth out, and, 3 months later, they're pregnant. I mean, I just got an email. I got an email at Christmas of a patient. He lives over in Central Oregon. And when I first met him, he and his wife had been trying for years to have a child. And he had all this, serious infection from decayed teeth in the front of his mouth. We got it all out, cleaned it all up, made him a couple of removable partial dentures so he could, replace a lot of teeth at once affordably.
Right.
And he sent me this picture of his 1.5-year-old, and like my heart melted.
Oh my
I'm
gosh.
like, unbelievable.
Oh my gosh.
So,
that is an amazing story.
It's super cool.
Wow. Yeah, it is super cool. Wow.
So it exists.
Yeah. And,
it's connected.
Right. And again, this is not common knowledge. So I love that you're sharing it with us, because I'm a huge fan of acupuncture. I've been getting acupuncture for 30 years. And yeah, I mean, I love that, okay, I might be having, terrible allergies, but the acupuncture point is on my foot, but that helps with my stuffy nose. And so, I don't know that any of us would, if we love acupuncture, we may not really understand the mechanisms, but it's something that's been on the planet for thousands of years, and it works. And so I do love the energetic meridians that you were just talking about.
Yeah.
That's fascinating topic.
Well, and I will share, like, one of the things that we are continuously working on developing in our practice, we probably have, for the last 3 years, is utilizing acupuncture meridian assessment, where we're using a machine that is able to measure energy flow along meridians, right? It's a technology that's been around for about 70 years. I've kind of been a student of Dr. Simon Hughes. He's in St. Louis, Missouri, and it is so fascinating when if we're curious let's say, somebody's wondering, I wonder if that dead tooth in my head, I wonder how the energy of that meridian's doing. You can actually work with a provider who's experienced in that and find out.
Wow. And so that is something you're going to be offering in your practice?
Yeah, it's something we've been, slowly integrating. I mean, it's like anything, right? We're practicing, we're in our newer phase with it, but it's wonderful. And it's, you can't injure anybody with it if you're literally measuring energetic flow. And it is, oh my gosh, I can't count the number of times where we have seen diminished energetic flow, and then either we remove what's there, or we might exercise some neural therapy where we inject some procaine and some ozone gas, and we'll see a regulation of the energy. Sometimes that becomes self-sustaining. Oftentimes it does not, which would indicate, okay, the tooth needs to go, or the bone area might have some infection in it or something like that. So.
Okay. Wow. Okay. So 2 more questions I want to ask about mouth guards, but then I also want to make sure we have enough time to talk a little bit more about your practice. So
thanks.
Mouth guard, and you're also doing a world tour, right?
Well, I'm doing a U.S. tour. Yeah. My
US
toxic tooth tour, which we could talk about.
Yeah. Okay. Well, I'll ask you about mouth guards, because that's a personal question, because I actually wear one because I'm a grinder.
Yes.
With all the BPA and BP everything, and are there are mouth guards, are there some better mouth guards out there? And do you need to get them from the dentist? And I just see somebody rolling with the homie says Blodgett's office is the best. And I
Oh,
love
God
that
bless
name,
you.
rolling with the homies, whoever that is.
Yes, I know her.
Okay.
Oh, God bless you.
Hi, Roland.
Yeah.
Yes. So let's talk about mouth guards.
Yes. Yeah. So, it's so funny. You're bringing this up at such an interesting time. Let me set up the context for why I'm saying that.
Mm-hmm.
I got, yesterday was a long clinical day. I got home at 9 o'clock last night to a text of a patient who's also a friend, and she has this tooth that is literally on fire.
Oh.
And I'm like, well, I'll be in at 7 a.m. Meet me at the office at 7. We'll figure it out. Now, mind you, her tooth that is hurting has never had a filling.
Huh.
It's a perfectly outside of the incredible amount of bite force that it's been experiencing. It's never had a filling. So the physical trauma of clenching your teeth together due to whatever, nighttime grinding stress, I mean, you name it, chewing on ice, really tough, crusty bread, you name it.
Yeah.
You can, in fact, split your own teeth in half, unfortunately. So,
Oh my gosh. Okay.
what she said to us, I mean, thankfully I was able to, make a spot today and get her tooth out and help create some relief for her. But she's like, can I get a bite guard? Now, for her, that is likely going to be a very helpful and appropriate thing for her to help her minimize the stress that she's putting into her own teeth. Does that mean that everybody who clenches needs a night guard? No. I would say that is a conversation worth having with your thoughtful dentist.
Okay.
It's just like, I don't believe in dogmatic approaches to this. It's about having a person-to-person conversation. I mean, my wife has been wearing a bite guard since I met her, right? And she finds it comfortable and helpful.
Yeah. I think once you get used to it,
So, I've known her almost 33 years. Am I going to tell her, well, I think if we get your bite balance that maybe you don't need it? Well, I don't know. If it makes you feel more comfortable and you sleep better, like, great.
Right. Why not? Yeah. Yeah.
So it's really more about personalized healthcare
Okay.
and coming up with solutions that meet the clinical appropriateness for your health.
Okay. So it's a good question to ask your, as you said, thoughtful dentist, which means thinking outside the box.
Notice the qualifier.
Yes.
Because again, if somebody's
good.
telling you, if your provider of any kind is saying you, and watch the word, need, you need this, the only thing we need is air,
Yep.
immediately.
Yep.
We need water, with it. We don't need root canals. We don't need crowns. Those are all options. They're all options.
Wow.
So
That's really
you don't
good.
need a night guard.
Okay.
It's an option.
Wow. Okay. I love that. I love that. Okay, so tell us about your, I'm just going to continue to call it a world tour because you're a rock star to me. And it sounds like, you're taking it on the road. So tell us about that.
Thank you. Well, thank you for asking. I appreciate the opportunity to share about it. So back in 2019, I had this, crazy idea that based on the communications that I was having with people through Instagram, like doing direct messages, I was realizing how much misinformation there is out there.
Yeah.
And so I thought, it would be really fun to just go to some different cities, or maybe if I'm giving a lecture somewhere, like I'll just rent a hotel room and I'll invite anybody who wants to come, charge a minimal amount to cover the room or whatever, but just give time and energy and accurate information so that people can become better informed. And, some of those people choose to come and see me for care, and that's great. Sometimes I'll refer them to people that are, within a driving distance from where they live. So as I was developing that, then COVID hit and the whole thing got shut down.
Yeah.
So I'm like, well, we'll come back to it. So in 2022, I did my first Toxic Tooth tour. I went to Kansas City, LA, Dallas, Texas, and New York City. And, probably all in all had like 100 and some odd people come to these, and it was so awesome. I mean, I'm outgoing and extroverted anyway, so I love
Yep.
meeting people. And it was just, I was so inspired by the people I met and the healing that I have seen both with the people who came to see me and those who've told me about seeing a better dentist in their area and how their lives have got, their health has gotten better. So
Okay.
this year I'm going back out and I've doubled it. We're hitting 8 different cities across the U.S. People can go to my, at Blodgett Dental Care and scroll down a few posts and just see like we're starting in Miami I think it's in 2 weeks.
Okay.
We go to Miami, Florida, San Diego, Austin, Texas, Phoenix, Denver, Colorado, Chicago, Nashville, Tennessee, and Boston, Massachusetts.
Love it. I love that. You're spreading the word, and it's really important because I just think that I'll just throw out, maybe 90, probably 95% of people would never connect the
Right,
dots between this and inflammation or cancer or for infertility. They just, I mean, and 5 years ago, I wouldn't have either. If I hadn't
right.
gotten cancer, I wouldn't have really started thinking about these things too. But I think once you have a disease or you see somebody have a disease, you'll do whatever it takes to not get it or not get it again.
Yeah.
And that I think really starts with your mouth.
Oh my
So,
gosh. I'm so
yeah,
glad you're saying it because it's so true. I find the practice of dentistry in general so interesting because like, you spend your first 2 years out of the 4 years of dental school doing, your microbiology, biochemistry, physiology, anatomy. You're like connecting all the dots, right?
right.
Nutrition,
Hmm.
which is limited, of course, but
I'm sure.
yeah. So you do all that, and then as soon as you get into the clinic and pass your first national boards, it's like everything's just about drill and fill, drill and fill, drill and
Hmm.
fill. And I would say maybe we think about generalized health just a little bit, kind of like the things you were mentioning, like, oh, did they have a knee replacement 3 months ago? Okay, we're going to put you on antibiotic. We don't necessarily
Hmm.
think about why, right?
Yeah,
It's like,
yeah.
well, is it even appropriate? And of course, the American Heart Association has continued to reduce the number of things for which we should do prophylactic antibiotics because of the damage we've done to people's human health, especially in the
Hmm.
dental industry with like throwing antibiotics at everything.
Oh, I'm sure. Yeah, yeah,
So
yeah.
it's unfortunate that it's not so connected in the educational process, but I am prayerful and hopeful that over time that we
Hmm.
will see this. And in the meanwhile, I'm going to spend my time and help people, better understand their own health.
Yeah.
And I get to meet great people in the process. I get to meet more dentists
I'll
who
bet.
also want to move in this
Right,
direction. And
right. Yeah.
if I can help lower their learning curve so that more people can be better served, I'm all about it.
Yeah. It sounds like you're really kind of getting into coaching and mentoring, which is just so greatly needed in this field.
Yeah, thank
So,
you.
yeah. So, Dr. Blodgett, thank you so much for coming on this IG Live, and I'll post it later today. I'll have all your information in there. And your Instagram page. I mean, I every time you post, I always just end up scratching my head thinking, oh my gosh, this is such good information. I didn't know that, or confirmation of maybe something I'd heard before. So, thank you for all the work you're doing. Really appreciate you.
Thank you, Deb. It's so great seeing you
Yeah.
again.
All right. Well, take care. Have
Yep,
a
talk
great
to you
rest of your day.
again.
Okay. Thank you.
Bye.
Bye.